Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Well, thank you very much for having me on the program.
Yes, sir. Before we get into COVID-19, I wanted to talk to you a little bit about kidney health. And I know that there are specific measures in place and there are projects that the ministry is currently working on. Where are we with that, especially that we're in the pandemic right now?
So, one of the things that we've been working on is to ensure that people with end-stage kidney disease can access treatment. And we have put together a team within the ministry under the chronic disease department of the ministry to look at not just kidney, but almost all the chronic diseases that we have in the country. We are now building out that program. Our anticipation is that we'll also have a plan for the next 5 years in different areas of chronic diseases. And hopefully we'll be able to roll that program out and change the landscape of what is happening with chronic diseases right now in Guyana. We have some very specific areas that we're looking at because of the prevalence of some of these illnesses or diseases. So one of our priority would be to look at diabetes, for example. And we have a number of special programs that we are developing. One such special program that we'll be developing for diabetes would include piloting a one-stop shop, so to speak. In this year's budget, we have allocated $35 million to build a facility that would be housing a couple of things. One, doctor's offices, a person who can provide nutritional advice to patients, persons who would be able to screen your eyes, because that is also important if someone is diabetic. Persons who would be able to do check your feet to ensure that your feet is okay, because diabetics can have these challenges with their feet, and of course to have good labs available. So when you come to this center, so to speak, all these services would be available to you. And we think by doing that, we'll prevent the kind of fragmented care that sometimes obtain. And we probably would be able to manage our diabetic patients much better. If this model works, then we'll replicate it in other regions. We have seen similar programs like this working in India. We have seen a program like this. I've had some discussions with a particular center in Haiti, and they have been working at this for the last 10 years or so. And there's also a program like this in Brazil. So it's not a new concept. It's just that probably it would be new to Guyana. So we are confident that once we implement this program, that we should see improvement in diabetic care. So that's one area, one of the chronic diseases that we want to look at. The other areas that we'll focus on this year include cancer care, and we are developing a specific cancer control program. We are getting some support from the International Atomic Energy Agency to help us to develop that cancer care program. There's a consultant that has been assigned to work along with us. And over the next couple of months, we are hoping to have that program develop, and we'll start rolling out that program. There are a number of subcomponents in that program, which includes the component dealing with the more prevalent cancers. So in men, you have prostate cancer, so we want to have a more dedicated focus on prostate cancer. And in women, we are looking at breast cancer and cervical cancer. So in each of these areas or diseases, we want to come up with sub-programs that would really address it in more detail, and hopefully we can prevent many of these cancers from occurring and thereby lower the prevalence of these cancers in Guyana. Cardiovascular disease is another area that we have a lot of focus on. And this year we'll be partnering with PAHO WHO to introduce a program called HEARTS. HEARTS is aimed at reducing some of the risk factors to cardiovascular diseases, and this include reduction of sugar consumption, trans fat, and all those other risk factors that can help to promote cardiovascular diseases. So we believe if we reduce those risk factors, then people would live a longer, healthier life. And that's the program that would be introduced this year. And some of these would have an effect on kidney diseases as well. So we are now spending a lot more time trying to develop specific programs and rolling them out, because we think it's very important at the national level to have these broader plans, but then implement them at different levels of the healthcare system.
All right. If I can take you back briefly to the one-stop shop, as you call it, for diabetes. I know in the meantime that that is being rolled out. There are already measures in place, and I note that in terms of regional healthcare, more has been invested into doing mobile clinics and outreaches and so on. If I can get you to briefly talk to us on.
Yeah, well, our current system actually from health centers, district hospitals, regional hospitals, and so we can care for diabetics and other people with chronic diseases. However, in some instances, the care has been a little bit fragmented, so that's what we're trying to address by using these new innovative types of methods and reaching out to vulnerable communities. Sometimes they're places, communities that they don't have a health hut or a health post. And as we identify those, we want to have mobile teams that would go in to those communities to help and to provide care for those persons. And of course, maybe to get them to come out if we detect anything that is serious and warrant a different level of care, that we are able to identify that and bring them out to get the right level of care.
All right, Minister, thank you. As we go into COVID-19 now, I wanted to do a brief update on the vaccines. We've had since donation from Barbados, China, India, and we are to get ours from COVAX. Have we had any particular update from COVAX? And more so, I want to mention sideways that last week, to the weekend rather, that Barbados was given a donation from Guyana, and I wanted you to briefly talk about that as well.
So we are grateful for the collaborations that we've had with a number of governments. Barbados generously gave us 3,000 doses of their vaccine when they first received it, and the government of China has donated 20,000 Sinopharm vaccines to us. And the government of India, of course, has donated 80,000 doses. With these donations, we've been able to kickstart our immunization program, which is ongoing. And we are very happy that we can do that. We have been working with these, mainly two types of vaccines in Guyana, and that's the Sinopharm vaccine and the AstraZeneca vaccine. And the uptake so far has been really good. We know from the scientific expert group that has been advising the WHO on the use of the vaccine that initially when they did the clinical trials for the AstraZeneca vaccine, the recommendation was for you to have your first dose and to have a second dose after four weeks. When the expert committee of the WHO reviewed the data, they then made another recommendation, and that is if you do the first dose, then maybe between 8 to 12 weeks you do the second dose, and the efficacy of the vaccine would go up to about 82%. So our protocols in Guyana has been that for the AstraZeneca vaccine, that we are using this longer interval between first dose and your second dose. And with that longer interval, we'll see the efficacy of the vaccine going up. And that's what we want for the persons, the citizens of Guyana, to have a better effect with the vaccine. And just by changing the time interval, we can have that better effect.
All right. As you mentioned, the time frame. So there is no indication as to a person going before that time, or before that time. And I'm asking specifically because there was a matter that was raised that persons were asked to come back at a shorter time.
No, we have a very standard protocol, so we're not going to encourage anybody to come before the time. So part of the process, when you come to one of the vaccination sites, the nurse or the clerical staff that is working there would explain to you what vaccine you are getting. They will enter that into a card, and then they would put the date when you got your first dose, and then put the date when you're expected to come back for your second dose. And so the time interval is calculated based on these protocols that we have developed. So all you need to do is to look at your card, your immunization card that you receive, and it will tell you the date for the next dose. And that's very important. So just follow the date. You don't have to probably be bothered by all the complicated science behind this, but you will have a date on your vaccination card when you need to come back to get your second dose of the vaccine.
All right, Minister, as we wrap up, I did want to talk about Barbados. A colleague of mine mentioned sharing is caring, and we see that we've had that relationship with Barbados, and we have initially made a donation. If any other country or so within the region that we collaborate with need that, would this also be offered to them once we can, of course?
We are open to you know, to helping, and it's something that is done across the region, you know, for different things, not just for vaccines, but something that probably goes that is, you know, we have these types of collaboration all the time. So sometimes we need something, a particular medicine, we don't have it here. We'll ask a sister country if they have, they send to us. Sometimes they have shortages, we send to them. So this is something that we have been doing, and you know, we have this type of technical collaboration that has been ongoing, and I think it works for all the countries who've been involved in this. And we are happy to extend this, the vaccines to Barbados, because they have helped us to kickstart our vaccination program, and we are just happy to assist in whatever way we can.
All right. Minister Anthony, thank you so much for speaking with us. All right, well, that's it for today's COVID-19 update. Of course, we just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.